These days, we see a significant increase in the number of haploidentical stem cell transplantation. And actually, this is really great news for our patients because almost every patient can have access now to a donor and whenever needed can benefit from a transplant, an allogenic stem cell transplant. Unfortunately, despite the success of this type of transplant, there are several unmet needs. Among them is the poor and slow immune recovery and also the high relapse rate. This is the reason why we need to have tools that allow to enhance immune reconstitution, but also maybe to prevent relapse. And this is actually the background behind the development of these genetically modified TK cells, or HSV-TK, which were developed over the last 10 years or so, with the idea to use these cells sort of a DLI to enhance, it's a modern DLI, to enhance immune reconstitution. And actually, during this American Society of Hematology meeting in 2016, we are reporting on a pair-matched analysis between patients who received T-cell, who received a haplotransplant without any further intervention after, versus haplotransplant who received these so-called genetically modified TK cells. And to make a long story short, we found in this pair-matched analysis, which is based on the registry of the EBMT, that the infusion of TK cells after haplotransplant can allow to improve outcome, especially when it comes to decreasing the incidence of opportunistic infections, to decrease the incidence of chronic GVHD, which is really an important issue, and at the end of the day, having an improved overall survival. Treatment of multiple myeloma has significantly changed over the last decade. When it comes to the younger myeloma population, this is where we consider high-dose chemotherapy and autologous stem cell transplantation. And the schema, when you decide to deliver auto-transplant in myeloma, usually includes several steps. First step is induction, followed by stem cell mobilization, delivering high-dose chemotherapy, and infusion of the graft. Now, more and more, it is well established in the myeloma community and based on the available research evidence that you need to deliver some form of therapy post-transplant. The treatment post-transplant can be divided into two major groups, I would say, the consolidation and the maintenance. When we speak about consolidation, it means that we want to deliver a relatively strong combination of drug relatively early after transplant, usually between 2 and 3 months, for a short period of time, with the aim to deepen the response that was achieved after high-dose chemotherapy. On the other hand, the goal of maintenance is rather to deliver a gentle therapy, preferably oral therapy, over a long period of time, and the goal is actually to maintain the results, the response, and of course, whenever possible, is to allow for continuous disease control. In both cases, whether consolidation or maintenance, the goal is to decrease the incidence of relapse, but also most importantly, in the case of maintenance, you would like to improve overall survival.